Okay, hi everybody. So we're looking now at phecc care principles, the Pre-Hospitals Emergency Care Council care principles, and there's 16 of them, and I'm going to try and keep it very, very simple, okay? These 16 principles need to be kept simple so we know what to do at a scene. We need to first of all make sure that the scene is safe. Once we've established that we need help or support, we need to call for help. We're going to call 999 or 112 and use the red card process, the request emergency dispatch process. We're then going to need to establish consent. If the patient is unresponsive, implied consent can apply. If the casualty is telling you to leave them alone, they don't want your help, but you still feel it's a ME, a medical emergency, you can leave the casualty and you can still call for help if you're worried about the situation being life-threatening. Okay, so we figure out if the situation is life-threatening, and if it is, we are going to call emergency services. We then consider primary and secondary survey. What we're really looking at with the next principles are the primary and secondary survey. We're establishing airway, breathing and circulation. We are controlling any crazy bleeds. We are treating the conditions accordingly. If we suspect spinal injury, we're immobilizing the casualty. If we feel that the casualty, or we establish that the casualty is not responding, but they are breathing and we don't suspect spinal injury, we can place them onto their side into the recovery position. We are going to provide reassurance to the casualty at all times. Okay, we are going to remain or maintain responsibility for patient care until handover of an appropriate responder. We're going to complete patient care records following interaction with the casualty, and in this we are like obtaining information from the casualty with our sample interview. We're always going to identify a clinical lead, so we're always going to let the most qualified patient take over, and ambulances, medical rooms and equipment should then be decontaminated as appropriate following any interaction with the casualty, that we're making sure that areas are kept clean in the workplace, at home, after we have given help or treatment. And that really is the 16 care principles recommended by phecc simplified. So I hope that makes it easier for you to understand. And we're now going to move on to the conclusion of Unit 2. Thank you.